Simply, it's an inherited bleeding disorder where patients bleed more than usual, either spontaneously or when they're exposed to any trauma. In around two-thirds of cases, it's inherited, usually from a maternal uncle. The mother carries the abnormal gene and transmits it to the son, to her son. And in around one-third of cases, it can be a mutation. So it's not a very common disorder, and that's why people don't know about it. It's one of the inherited bleeding disorders, usually affecting males and generally hereditary in most of the cases. Simply, first, take a good history. A history of bleeding in a boy, especially in the joints or after circumcision, especially when there's a family history of an uncle or a maternal granddad who has done this, is very suggestive of having hemophilia. And second, we do simple tests to detect, to see if there's any evidence of bleeding. A simple lab test called PTT, and if it's abnormal, then we look for the missing factor. Because generally these patients are born, in order to stop bleeding, you need to have good blood vessels, you need to have cells called platelets, and you need to have factors called the clotting factor that are proteins. And these are around 13 clotting factors. In hemophilia, there's one missing factor, either factor 8 or 9. So you do a blood test to detect the quantity of that blood factor in the blood. If it's low, that's hemophilia. Absolutely, yes. I think that's very necessary because I think in all hereditary disorders, in all chronic disorders, the best way to control a disease is to make the public aware of the disease, number one, educate the public about the disease, and very important, educate health professionals and policymakers, which are the government, because the treatment of this disease is very expensive, and usually the government has to offer the missing factor, which is the treatment for this. So awareness campaign is very important. That's the way to educate, to detect the disease at an early stage, to prevent the disease as well. A child who has hemophilia can live a normal life, provided he receives treatment at a very early age, and he receives the right treatment. What do I mean by that? Once they're diagnosed, they have to be treated. And the best treatment is to give a small amount of the missing protein or missing factor on a regular basis, what we call preventive or prophylactic treatment, so that that child does not bleed after trauma or spontaneously, what we call preventive or prophylactic therapy. The children who are giving prophylactic therapy, it's now evidence-based, very clear from the scientific literature and from our experience that children who receive prophylactic therapy will live a normal life without complications, and they can be productive in every respect. But this is not that easy. It's like utopia, until Medina al-Fadli, like utopia of Plato. So it's not easy because it's expensive. And that's why the role of the government is very important. And the collaboration of governmental organizations and non-governmental organizations, like, you've talked about GNK before. These are the collaboration of this, and the National Hemophilia Association that we have in Lebanon. The collaboration together is very important to provide optimal treatment for these children, because I feel they deserve a good life. It is their right to live and not to have pain. If you don't treat them well, not only will they have complications, but they will suffer from a lot of pain, from bleeding in the joints, bleeding in the muscles. They become crippled as well, and they will not be able to even get jobs, get to universities. So it's a shame. So we all have our obligations.